What you need to know about radiation therapy in the treatment for prostate cancer. Prostate cancer is the most common cancer in American men. 1 in 6 men will develop it in his lifetime. 240,000 men were diagnosed with prostate cancer in 2011. The good thing is that prostate cancer is very manageable and often curable. More than 98% of men diagnosed with prostate cancer will live more than 5 years after diagnosis. During external beam radiation therapy, multiple beams of radiation are directed through the skin to the prostate and the immediate surrounding area. This treatment destroys the main tumor and any nearby cancer cells by damaging the DNA in the cancer cells. When damaged cancer cells are destroyed by radiation, the body naturally eliminates them. Normal cells can be affected by radiation, but they can repair themselves in a way that cancer cells can't. The radiation oncologist consultation is a 1-hour detailed visit reviewing your past medical history. It will help educate you on your personal prostate cancer diagnosis, and the radiation oncologist will discuss which treatment options are suitable choices for your disease. During this consultation, the oncologist will discuss your Gleason score, your PSA, your stage, your level of risk for recurrence, and discuss which treatment options are best for you. There are a variety of treatment options available for prostate cancer. These include active surveillance, which includes repeat biopsies and PSA tests. This is an option in low and very low-risk prostate cancer. Daily radiation therapy, which includes image-guided intensity modulated radiation treatments. This is sometimes combined with hormone therapy for intermediate and high-risk prostate cancer patients. Brachytherapy, which is radioactive seed implants. Sometimes these are combined with 5 weeks of daily radiation with or without hormone therapy for intermediate and high-risk prostate cancer. Surgery, which is radical prostatectomy, which is usually performed robotically by a Da Vinci prostatectomy, is also an option. Sometimes radiation can be used after surgery for high-risk cancers. Hormone therapy involves removing the male hormone testosterone by either surgically removing the testicles or more commonly chemically with an injection that suppresses testosterone production. Another option for the treatment of prostate cancer is cryosurgical ablation of the prostate, where needles are used under ultrasound guidance to freeze the prostate. Experimental therapies like HIFU, which is high-intensity focused ultrasound, and other treatments for advanced or recurrent disease such as chemotherapy, alternative hormonal therapies, or radiation treatment for prostate cancer that is metastatic to the bone. There are a number of different complications that patients can experience days to months after the treatment, as well as months to years after the treatment. After radical prostatectomy, the more common acute complications include incontinence, possible blood loss following surgery, and discomfort. Late complications include incontinence, erectile dysfunction, urethral stricture, or some shortening of the penis. Short-term complications of brachytherapy or radioactive seeds include discomfort, burning with urination, blood in the urine, urinary frequency, and urgency. Long-term complications or side effects include erectile dysfunction, rectal bleeding, sometimes persistent bothersome urination complaints, as well rarely as secondary cancers. Following external beam radiation therapy, IMRT, patients will short-term experience fatigue, sometimes increased urinary frequency and urgency, as well as a slower flow, and sometimes soft bowel movements or diarrhea. Late complications following IMRT include erectile dysfunction, rectal bleeding, changes in bowel habits, urinary complaints, and again, rarely secondary cancers. When patients have hormone therapy for the treatment of prostate cancer, acute complications include hot flashes, erectile dysfunction, the loss of desire, as well as nausea, diarrhea, itching, weight gain, and fatigue. Long-term complications with hormone therapy include weakened bone, decreased muscle mass, and decreased blood counts from a low testosterone level that's achieved with hormone therapy. With radiation therapy, fiducials or gold markers are placed in a way similar to prostate biopsy. These provide a target in the prostate to align the treatment every day the patient comes in. It happens about a week before the CT simulation is performed. Your radiation oncologist and surgeon will design with you a customized treatment plan. A CT scan and/or an MRI will be done in the treatment position. This is called the simulation, which is performed by your radiation therapy along with your radiation oncology doctor. Your radiation oncologist will work with a medical physicist and dosimetrist to design a plan using information from your pathology, as well as your imaging studies and your physical exam. 3D targets will be created, including the prostate and nearby organs, to avoid, such as the bladder, the rectum, and the hip bones. Treatment is delivered in about 15 minutes, Monday through Friday, on a specialized radiation machine known as a linear accelerator that's made by a company called Varian. Each treatment is painless, non-invasive, and similar to a long X-ray picture. You'll hear a noise, but you will not feel any discomfort. Treatment usually lasts about 9 weeks or 5 weeks when this treatment is combined with brachytherapy. Your PSA will be monitored every 6 months. Your radiation therapist will deliver the treatments daily. Once a week after treatment, you will visit with your radiation oncologist. After treatment is complete, you will continue visiting with your urologist and your radiation oncologist, who will carefully monitor your PSA about every 6 months. Your radiation oncologist will have their scheduler contact you. Usually you'll be scheduled for a simulation first to plan the dose of radiation to be delivered. You will then be contacted with a surgical date as well as with instructions of where and when to report and any special instructions you may need. The pre-authorization process is essential. We will communicate with your insurance company to determine your coverage and any co-payments or deductibles that you might owe. We'll provide you with an estimate of any charges that you may incur. All charges will be due prior to the procedure, but payment plans will be arranged if necessary. You will follow up with your urologist and your radiation oncologist after your treatment is complete. Your PSA will be carefully followed. It does not usually go to absolute zero and may fluctuate from time to time. We will also carefully follow your urinary symptoms and your sexual function following treatment. Permanent radioactive seed implants or brachytherapy can be used alone or combined with IG-IMRT with or without hormone therapy depending upon the risk of recurrence of your prostate cancer. Brachytherapy is about a 1-hour outpatient procedure performed under anesthesia. The procedure is performed jointly by a radiation oncologist and a urologist. After waking up from brachytherapy, you usually are discharged to go home 45 minutes to an hour later with a urinary catheter in place. After losing their radioactivity within a few months, the seeds remain within the prostate. It's important for men to avoid prolonged close proximity to children or pregnant women for the first few months after the procedure. We hope that we can answer all of your questions and help you choose a therapy plan that is right for you. We sincerely appreciate your feedback regarding your procedure, as we are always trying to improve the care that we provide to our patients. If you have any questions at any time regarding your procedure or recovery, please contact your doctor. Thank you.